Hello and welcome to Time of Death.
Hello and welcome to Time of Death.
I'm your host, Dee.
And I'm your host, Ris.
And together, we are Time of Death podcast. We are two registered nurses here to talk your ears off. Ris, do you want to give them your spiel?
Sure, I'll spiel. So, we are two nurses who started this podcast with the desire to talk about true crime cases that have either, a heavy medical influence or cases that feature a medical professional as either the perpetrator or the victim. We just like to talk true crime, and if you enjoy, feel free to join us on our journey of crime.
And feel free to like, rate, review, and subscribe. And thankfully, just in the nick of time, my voice is back. So thank you, God, because that would have really sucked.
Twice in a row.
So I'm going to get right into it tonight. So
We're ready.
Fantastic. So picture it. I always start my cases with picture it. Like the dearly beloved Golden Girls sister.
Picture it.
Picture it.
Sicily. 1923.
But this takes place at 8:15 p.m. on February 19th, 1994.
Okay.
So a young woman is rushed in by paramedics on the stretcher. And they bring her into the emergency room at General Hospital in Riverside, California. They run through the double glass doors and swiftly take her into the trauma room. She's barely conscious. She can only manage brief and sometimes incoherent responses to the questions they asked her. She had shallow, rapid breathing, aka Shane Stokes. I had to Google how to pronounce that because I've always been calling it Cheyenne Stokes.
Well, it looks like it's spelled like you would start the word Cheyenne, so Cagy.
I feel like Cheyenne Stokes is a good character name for like a book.
That is a good name.
Yeah, Cheyenne Stokes.
Perhaps a true crime medical novel.
Oh, I like it. But anyways, she has back to our girl in the real world. These respirations are what the medical community calls, who actually know how to pronounce it, Shane Stokes. And it's a type of respiration that's abnormal. A lot of times you'll see that with people with DKA. And DKA, for those who might not know, is diabetic ketoacidosis. And I'm jumping all over the place here, but I'm a little out of my depth in this case. I do have to admit. So Ris is going to have to chime in pretty frequently because I never worked in the emergency room setting. And our dear Ris is an excellent emergency room nurse.
I try. Thank you.
So we're going to need some input from you.
I will provide input.
She also had something called tachycardia, which I didn't know how to pronounce, thankfully. But essentially what that is a rapid heart rate. So anything over 100 beats per minute would be considered tachycardic. So Ris, what is the first thought that you have if you were given a patient who presented similarly to this young woman?
Okay. So DKA, diabetic ketoacidosis, it can be very serious, okay? Someone who comes in DKA either has a history of diabetes, most of the time it's type 1, or they haven't been diagnosed and they are newly diagnosed during this visit for the first time. Sometimes you have kids who come in their first bout of DKA, and that's the time of their diagnosis. It's not caught earlier than that. That can happen. But anyway, when people come in DKA, their sugar is sky high. All their electrolytes are a bit wonky. You really need to regulate their body because their body is in like a acidotic state.
Their pH of their blood is off and that wreaks havoc. It can cause altered mental status. It can cause kidney damage, heart, internal organ damage. It can wreak havoc on your body. And that's why, like, the long-term effects of diabetes are very serious too.
So basically, your body is not making enough insulin. Insulin helps the blood sugar in your body be utilized.
Mm-hmm.
When there's not enough insulin to do that, your sugar is just in your bloodstream, not being used, floating around, and your body isn't using it to make energy. So it has to rely on other things, such as fats.
Ketone.
Yep, exactly, to be broken down to be used to make energy. And basically, the ketones build up in the blood, collect in the urine, and your body just goes off kilter because of this, and it can be life-threatening.
Absolutely. Thank you, Riz. That was an excellent explanation. And
Thank you.
DKA used to be my favorite patients to treat because you can get them right in one shift and then ship them out. Right? Am I right?
You
Am I
can.
right?
No, it's true. You can.
So it's an easy fix most of the time. Not to say to let yourself go into DKA because they're going to fix you, but all it takes is a little insulin to get you right.
Sometimes. Some insulin and fluids. Yep.
So right off the bat, you're thinking DKA for this person, or what are your thoughts?
Well, you said she's presenting with DKA or DKA-like symptoms.
I said you see Cheyne-Stokes respirations a lot of time in DKA patients.
Okay. Well, yeah, when I hear Cheyne-Stokes, I think DKA. So she probably, looks like crap. Her heart rate's high.
Mm-hmm.
She's going to be weak. She's going to be tired, probably confused. When your blood sugar is that high, people can get disoriented quickly.
Mm-hmm.
So they don't really know what's going on. Sometimes they can have vague symptoms like they feel weak. They can have some shortness of breath, hence the Cheyne-Stokes respirations. And also it's your body's way of compensating for you being in that acidotic state. So it's like, I got to breathe off some of this acid that's built up in my body. So let me breathe this way. So it's kind of cool that your body will try to compensate for you and fend off the acidotic state that you're in. She looks dry as a bone. She's probably, what do they say? The 3 polys: polyphagia, polydipsia, polyuria. You're peeing. You're thirsty. You're eating. You're
thirsty.
You're thirsty. You're peeing.
Riz, you're so animated tonight. I love it.
Right before this podcast, I was so pissed off. I had such an attitude. And then I decided I'm going to smile.
Aww.
And I'm going to be a good little nurse.
You are a great little nurse all the time. Our little Riz was recently the charge nurse in her emergency room. So shout out to Riz.
For 4 hours.
That's amazing. That is amazing.
I was terrified. It was my first time ever being charge nurse.
And she did a great job.
Thank you.
So what's very unusual about this patient's presentation that I didn't include previously is that she is 31 years old with a very recent diagnosis of cervical cancer. She was only diagnosed 6 weeks prior to her coming to the emergency room that night.
So then my brain's thinking, okay, what's going on here? Is she, a immunocompromised patient who, maybe has an infection going on? Is maybe her cancer, worsening? Maybe she has some comorbid things going on. I don't know. I'd have to hear more.
It's completely out of left field what happens.
Okay.
So her name was Gloria Ramirez. I don't know if you're familiar with that name.
Nah.
So what we're going to do tonight is we're going to delve into the perplexing circumstances that surround her case and the mysteries that ensued, because it is a mystery. So they give her medications like lidocaine, codeine, benzodiazepine. These are all medications that you would see for people who have chest pain, that are like in cardiac dysrhythmia and, altered mental status. So these are like standard meds used in the 90s at that time. Unfortunately, Gloria does not respond to those medications, and nursing staff decides that they need to defibrillate her heart. They decide to shock her.
Maybe she was like in a VTAC or a VFib.
Right. She was in some kind of dysrhythmia.
Yeah. Okay.
So during this process, like if you don't know, and a defibrillate or cardiover or whatever, essentially you're shocking someone with electricity to try to get their heart back to a sinus rhythm. So like a normal rhythm for your heart. So during this process, they put leads on your chest. And during that time, healthcare workers noticed that there's almost like a oily sheen on her body. And there's a very weird and very noticeable fruity, garlicky odor coming from her mouth.
That does tie in with the DKA, but except for the garlicky. Sometimes when you're in DKA, you can have a fruity odor to your breath, but not garlicky.
It gets
From what
weirder.
I've smelt.
It's getting weirder. Maybe she just really liked garlic bread.
It's true.
Who knows? I'm so sorry. We had a puppy break because the cutest little baby just came in.
A little 6-week-old Chiweenie. Dachshund Chihuahua mix.
I'm actually a little scared of chihuahuas, so it's interesting that dog was so cute.
She was very sweet temperament.
Mm-hmm.
She's little, but I think she was also terrified, but
Probably, and then your cat is stalking her.
Bubba's like 10 times her size.
Bubby's like, I smell dog.
He tried climbing into your lap to see the baby.
He just loves babies. That's the thing. He loves babies.
He's like a mother.
He's sitting here and just sniffing the carrier that she came in. So there was a registered nurse named Susan Kane that drew blood from Gloria's arm, and she said that it smelled like a very strong ammonia-like smell from the blood sample itself.
Okay, then my brain goes to like a hepatic encephalopathy. But I don't know.
Keep this in
I
mind.
don't know anymore.
Keep these theories in the back of your mind.
Okay.
Kane then passed the tube to medical resident Julie Grokinski, who noticed like small, like yellow white particles in the blood sample itself. So they're looking at this, and all of a sudden, Kane faints. And then shortly after, Grokinski faints too. So the nurse and the medical resident pass out.
Oh my God. How? Why?
They felt very nauseous before they passed out, and then they
Was
faint.
it because of the smell, maybe?
Maureen Welch, who's a respiratory therapist, was the third healthcare worker to faint.
Oh my God. They're all going down. The ED is going to have no one. We're already short-staffed as it is.
But when Maureen Welch came to, she could not move her arms or legs. After everyone started passing out, emergency protocols that were established previously were then initiated, and they evacuated patients out of the ED. And during that time, they were doing evacuations of the other patients. A team continued to work on Gloria because at this time she was not stable.
Mm-hmm.
Despite 45 minutes of CPR and defibrillation, Gloria then passed away. And this was kidney failure related to her cancer. Unfortunately, nothing that they can do.
Mm-hmm.
23 individuals at that time, who were all near Gloria, fell ill, and 5 of those 23 required hospitalization. So at that time, the California Department of Health and Human Services dispatched 2 doctors, one Ana Maria Osorio and Dr. Kirsten Waller, who were in charge of investigating what had happened that night. They surveyed 34 hospital staff members who were present that night in the emergency room. And through a questionnaire, they were able to find commonalities among the symptoms, including loss of consciousness, shortness of breath, and muscle spasms. They determined that high-risk factors included anyone who was in close proximity to Gloria, which was considered within 2 feet, and anyone handling her intravenous lines. Gender was also a factor in this. They said that more women were affected and that because there were normal blood tests post-exposure, they did not attribute this phenomenon happening as a result of any type of fume being impacting the healthcare workers.
That's interesting.
Mhm.
I don't understand. Like, maybe it's...
They believed that it was mass hysteria.
Mm.
Mm.
In a female-dominated...
When you think about an ED healthcare worker, they are truly able to handle the most stressful situations, I would say. So I agree that this was not the case, and it was actually really insulting, like you said, because, again, majority of nurses are female. Would they have suggested this if more men had succumbed to whatever this mysterious illness was? But a lot of the healthcare workers, specifically the medical resident, took offense to that comment. And what she said is that her medical history spoke volumes, in that she had to spend nearly 2 weeks in the ICU after that incident. And she experienced ongoing breathing issues, hepatitis, and avascular necrosis in both of her knees.
Oh my God. What is going on here? Number one, that claim is dismissive and offensive.
Mm-hmm.
And I don't blame this doctor for being pissed about that. That's just very insulting.
Absolutely.
And number two, what is going on here? I don't understand this.
It's so crazy. You're going to be amazed by what the explanation is. So the hazmat team took Gloria's body and they searched the ED high and low for any sign of poisonous gas, toxin, anything that could be a potential cause for the staff falling ill. So they ended up sealing her body in an aluminum casket and they waited. The first autopsy that they did not happen for more than a week after her passing.
Mm-hmm.
And when they did do it, they did it in a special room in an environment where the autopsy team wore hazmat suits as well. 2 more autopsies were done after this, for a total of 3. The second one was 6 weeks after the initial autopsy. So now she is 7 weeks postmortem. And the second autopsy was much more thorough than the initial. They found traces of Tylenol, lidocaine, codeine, and Tigan. Tigan? I don't know if I'm saying that right. Which is an old school anti-nausea med.
I haven't heard of that one.
Basically, they thought that that may have been related to what happened in the emergency room because Tigan was broken down into amines in the body, which may have contributed to the ammonia smell that healthcare workers reported from her blood sample.
Could have been from the Tegan being broken down?
Mm-hmm, because it was broken down into amines in the body. It basically is the byproduct having to do with ammonia that would have explained that smell.
I feel like they would have known that before, though, because it's not the first time Tegan's being used. Maybe her body wasn't processing things correctly or something.
Just wait for it. Wait for it. So the lab proposed that during that time, not only might have the Tegan contributed to that smell, but they basically created an explanation or determined an explanation as to why the healthcare workers got sick. So, have you heard of dimethyl sulfoxide, which is DMSO, before?
Sounds vaguely familiar.
So, it is an old school, like naturopathic home pain remedy. It's used as like what used to be used as like a topical pain relief. A lot of times for different cancer patients. So the reason that they were starting to investigate DMSO is because there were a couple different factors. The first of which was the greasy appearance on Gloria's skin that the healthcare workers noted. along with the garlicky smell that they smelled on her breath.
Ah.
So, again, dimethyl sulfate is like an alternative cure for late stage cervical cancer back in the 1960s. It was used as a cure all, pain, anxiety, various health conditions. Athletes used it, moms used it, kids, everyone. However, in I think it was 1965, the study that they did showed that DMSO caused blindness in mice, which at that point, most people stopped using it. And in the 1960s, they ended up listing it as a toxic substance. Because they listed it as a toxic substance, it was really difficult to get your hands on it at that point.
Mm-hmm.
And one of the ways that they were able to get it, especially in the 90s, was at hardware stores. Why would you go into a hardware store for this DMSO naturopathic cure, you might ask? Well, the DMSO could be found
Oh no! Don't tell me they've been using like WD-40 or something on their bodies.
a degreaser. DMSO was prevalent in this specific type of degreaser, which is industrial grade.
Was Gloria using the degreaser?
Mm-hmm.
Oh my god.
So in the degreaser, instead of like the cream that they were using before, it was much, much more concentrated.
Mm-hmm.
And because Gloria had a urinary blockage due to kidney failure from her cervical cancer,
Mm-hmm.
this caused DMSO to build up significantly in her system. In the ambulance ride over to the emergency room, EMS gave her oxygen. And by giving her a lot of oxygen at that time, it would have formed dimethyl sulfone, DMSO2. And from there, the DMSO2, hypothetically, could have been converted to dimethyl sulfate, DMSO4, which is highly toxic and a gas, incidentally.
Okay.
So once the DMSO2 was converted to DMSO4, the highly toxic compound, the gas would have gotten into the healthcare workers' eyes, mouths, nose, lungs, and as a gas, DMSO4 destroys cells. And symptoms reported are nearly identical to what this toxic gas would cause in human beings if they were exposed to it. I think it was 19 out of the 20 reported symptoms matched what DMSO4 toxicity would have been and manifested as. So the third autopsy basically agreed with the conclusion that the DMSO was the culprit behind what happened to the healthcare workers in the ED. This is hypothetical, and Gloria's family adamantly denied that their mom used DMSO. So, little contradicting, but it makes sense.
Yeah.
Like, the evidence is there. And if you're struggling with cancer, she had 2 young children and a husband, maybe she would, but we'll get into that a little bit more because they may have not known everything that she was doing. Yep.
Hypothetically, you'd apply that.
Topically.
Yeah.
And then because her kidneys shut down because of the cancer, it caused an excess. And then the oxygen helps convert it and then defibrillating it. It's like, it is the perfect storm.
Yeah.
So they did do the third autopsy. They agreed. And then Ramirez, Gloria's family, absolutely denied this. They took offense. And they actually had their own independent pathologist look at Gloria's body. And he could not ascertain a specific cause of death due to organs being missing. There was cross-contamination of other organs with fecal matter, which was very, very strange. And then at this point, she was severely decomposed. Her family blamed the hospital for Gloria's outcome and described it as deplorable conditions causing her death. Now, the hospital had been cited before, but at that time, the investigation that was done concluded that there was no evidence of negligence on behalf of the hospital. On April 20th, 1994, 10 weeks after her passing, Gloria was finally laid to rest at Olivewood Memorial Park in Riverside, California. There was a science textbook in which Patrick M. Grant proposed the chemical explanation that we just discussed as the most probable reason or probable solution for what happened that night in the emergency room. There has never been a credible explanation offered besides the DMSO theory for what happened that night in the emergency room with Gloria Ramirez and the healthcare workers. Patrick's explanation has underwent evaluations by professional forensic scientists, chemists, toxicologists, has been peer-reviewed, and went on to become published in the Forensic Science International Journal. Ultimately, I think what the big takeaway is from this case is that truly the human body is they talk about space being the last place of exploration and understanding, but really the human body is still not well enough understood.
Yeah.
There's no definitive explanation for what happened that night. Yes, there is a probable explanation, but it's not absolute. Mm-hmm. They can't say with absolute certainty what happened to this poor woman. And Gloria has gone down in infamy known as the toxic woman. And I feel like that is so unnecessary and so disrespectful to her because she was a person.
Yeah, and she was, she had cervical cancer.
Absolutely.
And if this is what happened, then this was the way that she wanted to combat her symptoms. She didn't do it because she knew inevitably that this was going to happen.
Absolutely.
In the end, no, that's not fair to say.
It's not fair. She was a wife. She was a mother. She was a person described as a friend to everyone, a joker, and how much joy she brought to other people.
Yeah.
She was 31 years old. Mm-hmm. And her life, she really was desperate because there was no medical solution. She had to have been using this as either a cure or for pain management. Mm-hmm. And it just shows that how lacking the healthcare system really is.
Yeah.
That she was driven into the arms of a degreaser because she wasn't receiving proper pain management or curative treatment.
Yeah. Desperate, times call for desperate measures. If she thought this was her only, possible relief or her, cure all, then maybe, who wouldn't try that?
Absolutely.
But no, this is, I'm sorry to all the healthcare workers that were affected, but there's no ill intent here. I'm not going to, she should not be referred to as the toxic woman. That's just not fair to her and her memory.
Absolutely. I keep saying absolutely, but it's so true because, you hear people, like you said, who are absolutely desperate, doing whatever they can just to have a few months longer. Mm-hmm. And there should be no fault in that. Again, it's very unfortunate what happened to the healthcare workers, and we hope that they are well. We're here for the patients. Mm-hmm. Yes, we're here to support our fellow healthcare workers too, but empathy and understanding are so important in being good nurses. Mm-hmm. And I think that we would all benefit from just a reminder about empathy, being kind and understanding what someone might be going through and why they would be driven to different circumstances.
Well said. Well said.
Thank you. Good. It was a great case.
Yeah, I enjoyed this case.
I was a little distracted by this cute little doggy, but it's all good.
Lily, the little puppy, the little Chewini.
Chewini! Our new sister. She's going to have to be part of the podcast too. So, Riss, do you want to call it?
I will call it. The time is 2014. That is 8:14 p.m. for those of you who do not use military time. We are calling it. Bye.
Bye.